Today, we're going to talk about something called a ventricular septal defect, or VSD for short. Now, it's one of the most common heart conditions a person can be born with, but the story behind it, how it's found, what it really means, and how doctors treat it is actually filled with some pretty surprising twists and turns.
So, what are we really talking about here? Well, at its most basic level, a VSD is literally a hole in the wall, the septum, that divides the heart's two lower chambers. You can kind of think of it like a leak between two crucial pipes. This little opening lets blood that's full of oxygen flow from the left side of the heart back over to the right side, which, as you can imagine, creates a whole lot of extra work for both the heart and the lungs.
Okay, so how does this whole journey of discovery usually kick off? Let's dive into how a doctor first gets an inkling that something might be up.
That's right. The very first clue isn't something you can see. It's not even something you can necessarily feel. It's a sound. It all starts during a totally routine checkup when a doctor puts a stethoscope to the chest and just listens. And they hear something that's not supposed to be there, the distinct sound of blood moving through that tiny opening.
Now, doctors have a very specific vocabulary for these things. That whooshing sound, they call that a harsh pansystolic murmur, which is just a fancy way of saying it's a rough sound they can hear through the entire heartbeat. But here's what's really wild. Sometimes they can actually feel it too. A systolic thrill is this fine vibration on the chest wall. The best way to describe it? It's kind of like the purr of a cat. It's the literal physical sensation of that turbulent blood flow.
So a doctor might hear something, or even feel something that's a bit off. But that brings up a couple of big questions. Where does this hole even come from in the first place, and what happens if the signs start getting more serious?
While a lot of VSDs are only picked up by a doctor's trained ear, if the condition is on the more severe side and it starts to lead to other problems, well, the signs can become a whole lot more obvious.
And the most serious sign you can actually see is something called cyanosis. This is when the skin starts to get a bluish tint. That happens because the blood that's circulating through the body just isn't carrying enough oxygen. For a VSD, this is a massive red flag. It points to a really severe long-term complication known as Eisenmenger syndrome.
This all naturally leads to the big question, doesn't it? What's the root cause? How does this hole get there to begin with?
Well, there are basically two main paths. The most common one is congenital, which just means you're born with it. And sometimes it's linked to other conditions like Down syndrome. But you can also get a VSD later in life. This is way less common, but it can happen, usually as a rare but very serious complication after a major heart attack has damaged that wall between the ventricles.
So, this is a really crucial point. We need to understand why this little hole can be more than just a minor hiccup. Let's get into the potential complications.
All right, let's just tackle this head on. What are the actual risks we're talking about when a VSD is more than just a small, insignificant little hole? The complications tend to follow a pretty logical but dangerous chain reaction. First, all that extra blood flow makes the heart's ventricles work way harder than they should, causing them to get bigger or enlarge. That's what LVH or RVH means. Now, if the heart can't keep up with this extra workload, it can lead to what's called congestive cardiac failure, or CCF. At the same time, all that blood being forced into the lungs' arteries causes the blood pressure in there to spike. That's pulmonary hypertension. And the final, most severe, long-term result of all that pressure, that's Eisenmenger syndrome.
Okay, so with all those risks in mind, how do doctors get a crystal clear diagnosis and then figure out the best way to handle a situation? They've got a few key tools in their toolkit to actually see what's going on inside. An echo with Doppler is basically a high-tech ultrasound of the heart that gives them a direct look at the hole and shows exactly how the blood is flowing through it. An X-ray can show if the heart has gotten bigger, a condition they call cardiomegaly. And an ECG, an electrocardiogram, checks the heart's electrical signals for signs of that muscle stress we were just talking about, the RVH or LVH. So, the diagnosis is confirmed, they know the size of the hole, they know the impact it's having. What happens next? What's the plan?
And this part is absolutely key. Not every single VSD needs surgery. You might think every hole needs patching, right? Well, not so fast. For the small ones that aren't really causing any problems, the approach is often just wait and watch. They monitor it because a lot of these can actually close up all on their own, especially in kids. But for the bigger VSDs, the ones that are affecting a child's growth or causing signs of heart failure, then yes, surgery or a catheter-based procedure is the way to go.
Now, this is honestly my favorite part of this entire explainer. It's a classic medical pearl called Malady the Roger, and it's such a fantastic paradox.
What it means is that sometimes a really, really loud murmur, the kind of sound that seems incredibly alarming, is actually being caused by a tiny, insignificant hole. See, the smaller the opening, the faster the blood has to rush through it, and that creates a much louder noise. And the best part? These are very often the exact ones that end up closing spontaneously, all by themselves.
So it just leaves you with this amazing thought, right? A loud, scary alarm can sometimes signal a tiny problem that's already on its way to fixing itself. It's just a perfect reminder of how complex and sometimes how completely counterintuitive our bodies can be. It really makes you wonder, what other incredible paradoxes are just hiding inside us, waiting to be understood?